Good morning, Maria.
Good morning.
How you doing today?
I'm doing good.
Great. So we've known each other for a long time, like
Yes.
12, 13 years,
Yes.
right?
Mm-hmm.
And originally you came with some back problems and pain
Yeah.
right in your leg, and
Yes.
we probably did some injections to start many years ago, and then I said you need to see a surgeon.
Yes.
So then you had a fusion,
Mm-hmm.
and she had rods and screws placed in her back from L4 to S1, and I guess you did okay for a while.
Mm-hmm.
But then recently, over the past year or so, I think you developed a lot more symptoms, right?
Yes.
What was it like a year ago?
I always had a lot of pain. I couldn't walk. I couldn't sit.
So you had problems with your legs were
Yeah.
very painful when you were walking. Your
Yeah.
back hurt too.
Yeah.
So what happened was that above her fusion, she had rods and screws here, but she developed what we call adjacent segment disease, or narrowing and stenosis above her fusion. And it was kind of choking off her spinal canal and was causing back pain and difficulty walking, and probably had trouble with getting up and out of a chair and change position because there was some movement and instability. So we'd originally sent you to see a surgeon, but he didn't think he didn't offer for further surgery.
Yeah.
But you clearly need something done, and we did some injections and they weren't working. So what we decided to do was to place a couple screws in here, and we put the screws through, heading more laterally and obliquely through the joints in her lower back. So there were joints here, and I was able to place a screw through the joints this way into the vertebrae and here. So the option would have been to take out all this hardware here and extend the hardware up, which has been a very big surgery, but instead we did a minimally invasive surgery where we put 2 screws in, one on each side through the joints to stabilize above the fusion. And so originally, right after surgery, you were having some leg pain, but that has resolved since then.
Yes.
We did it a little over 2 months ago. And now the back is feeling a lot better.
Yes.
And the legs are feeling better.
Yes.
In fact, before the surgery, you told me that you could only walk to the mailbox and only stand 2 to 3 minutes, and you were kind of all bent over when you were trying to stand and walk.
Yes.
But now you said you could walk up to a half mile. You can stand 30 to 60 minutes, and walking is no problem. Your leg cramps have gone away, so you really had a remarkable recovery. So,
Yes, I have.
So anyhow, I just want to let other people know that if they have a fusion and there's a problem above the fusion, there is a minimally invasive treatment. We did as an outpatient downstairs. And how much pain was there afterwards, after the procedure?
Right now, like a 2 or 3.
No, but I mean right
Oh,
afterwards.
back then it was a 10.
For a week or 2?
Yeah.
Yeah, so fair amount of pain for a week or 2, but then it resolved.
Yeah,
But we had
gradually it went
had to
away.
fix a lot, yeah. So overall, you're happy that you had it done?
Oh yeah.
Your quality of life has improved?
Yes. I can walk now and I can bend down and I don't have cramps anymore.
Fabulous. Now you've had a remarkable recovery.
Yes.
I'm so glad I was able to be part of it. So
Thank you
very much.
Thank you.
Okay, bye-bye.